everyone. My name is Kim Cantrell. This is my in-service for my time at TheraSport. I am a Lanier Tech PTA student. Today I'm going to be talking to you about myofascial decompression for patellofemoral pain syndrome. So what is myofascial decompression? It's cupping. Cupping's been used for thousands of years. Myofascial decompression is unique as it is decompressive in nature. The negative pressure created by suction draws skin and fascial layers away from the midline of the body, and the decompression allows altered blood flow and metabolic change in the tissues. Myofascial decompression has been shown to be as effective as improving flexibility and decreasing pain, as effective or better as heat, stretching, or foam rolling. Myofascial decompression helps draw toxins out of the muscles and to the superficial veins to be removed by the body, and it leads to decreased pain and decreased tension in the tissues. Myofascial decompression may enhance mobility through affecting fascial adhesions, tissue temperature, and the viscosity of the tissues. So today we're going to practice myofascial decompression for patellofemoral pain syndrome. I picked this subject because I actually have patellofemoral pain syndrome. Stephen told me during my time there at TheraSport that no one comes into therapy because their VMO is just too strong or their vastus lateralis is just too flexible. One of the most common causes of patellofemoral pain syndrome is an imbalance of muscle strength. It could also be from overuse, it could be trauma. Women are more susceptible than men just because we have a greater Q angle because we got to bear those children. So anything over that 18 degrees is going to put some more stress on that vastus lateralis and pull on that patella. So what we're going to do is we're going to practice cupping. We're going to put the cups in 4 different places. We're going to start on the quad, and then we're going to go to the vastus lateralis. Then we're going to go to the lateral retinaculum, and then right there on the patellar tendon. So just a few things that you want to be thinking about when you're doing this technique. Number one, you always want to assess for precautions and contraindications. You want to make sure that there's no malignancies in the area, there's no hematomas, there's no open wounds. You want to make sure that there's no uncontrolled high blood pressure. You want to make sure that when you're applying the cups, whichever area is causing the most pain, that is not where you want to put the cup first or last. So you might put, if your pain is here on the lateral side, you might put your quadricep, your lateral vastus lateralis, then maybe the painful spot, and then maybe the patella. So you want to kind of do it in that order. Each treatment needs to be no more than 3 to 5 minutes. We'll apply the cups. I'm going to have someone assist me. We'll apply the cups. We're going to spend 1 minute just passively, just hanging out with those cups. And then we want to get active. We want to make sure that we're doing flexion and extension, trying to get more movement and more separation of those tissues, so they can slide and glide a little bit easier. Then we're going to retest at the end. So since I say we're going to retest, I probably should have told you that we're going to test first. Since I do have this, I do have a super friend here with me today. I'm going to change my clothes and we're going to test where my knee flexion is. We're going to do the Thomas test, we're going to test knee flexion, and then we're going to do a single leg squat. For the Thomas test, we're looking for 75 to 90 degrees of flexion. For the standing single leg squat, we're looking for any deviation in form, we're looking for a valgus knee, we're looking for maybe not as deep range of motion. So if you'll sit tight, I'll go get dressed and we'll be right back. All right, so we're going to start with the Thomas test. My left leg is my affected leg. My right leg is it's pretty good. Probably won't be for long if I don't get this fixed. But we're going to see where it's at. As I mentioned before, we want that flexion to be 75 to 90 degrees. So you're going to ask your patient to slide to the end of the table, almost like they're about to come off the table. You're going to pull one knee up, and you're going to let the affected leg just hang. Hang. So you want to tell your patient to make sure that their lower back is pressed into that table so that we don't have any rotation of the pelvis. Okay? And you can also assess too from this position, is this quadricep, is this hip flexor, right? If my hip flexor is all the way down, but my leg is still extended out, then it's quadricep. If it's my hip flexor, it's going to be more like this. Okay, and that's how my superfriend Caitlin is. Okay, so I'm going to get into that position, and she's going to measure my knee flexion here. $54 degrees. Okay, so I'm a little short of my 75. No problem. All right, so next we are going to do a single leg squat. Okay, I'll do one on the left and one on the right, and then I will turn sideways so that you can see that angle as well. Okay, so left single leg squat. Okay, so we're looking for any valgus or range of motion issues here. Okay. Okay, that's the left. Now here's the right. Considerably better. Okay. Good. Okay. All right. So now we've got our pre-test. It's ready to do the treatment. We're ready to do the treatment. Now I've got my handy little timer. Got my cups. And I've got my superfriend. Okay. So for this technique, you want to make sure that when you apply the cups that they are in a semi-relaxed position. So you're going to apply the cups from a seated position. And then to do the movement with the intervention, you're going to go to a lying down position. So what we're going to do first is we are going to mark our spots with some free up. So we're going to go right here on the quad. Okay. Right here on the vastus lateralis. Right here on that lateral retinaculum. And then we're going to go right here on that patella tendon. Probably a little bit more to the lateral side. You want to kind of move around, go back and forth in different directions, kind of feel where the restriction is. To me, it feels like it's everywhere. All right, so what we're going to be using, the cup set from cuptherapy.com. The really cool thing about this cupping set is that the cups are curved. Let's go find the curved cups, there we go. So that they're curved, especially for like areas here that are not completely flat. You want to have those curved cups. And I can probably get away with some flat ones on these bigger areas. So let's go flat here. Okay, so you just put your little, whatever this thing's called, on top. Okay, and then I'm going to go ahead and give her a few pumps. There it goes. Good. That's good. All right, so we've got one. Ooh, it's tight. You feel it? Yep. Okay, ready for the next one? Sometimes what I have to do with these, I have to kind of pull this out. And then, yeah, put it back in like that. Okay. Feels great. Okay, that's good. Okay, so next we're gonna go, ooh! Yep. So we're gonna go curved one right here. Some of these are still brand new. Right here on that lateral retinaculum. Whoa, okay, yes, feels good. Okay, and then let's put a small one. We're gonna put a small curve right there on that patellar tendon right there. Now on this smaller one here, once we start doing the active motion, the active range of motion on this can tend to kind of pop off a little bit just because of the nature of where it is. So for this one, we're actually going to leave that pump attached to it. Yep. All right, and if you you wouldn't mind taking all these things off the table. Now I'm going to scoot to this end of the table, and I'm going to get into a supine position. And you can have your patient hold on to this, or you can hold on to it. Oh, goodness. I'm going to set a 1 minute timer. I want to try to keep my leg pressed or my back pressed into the table, and I want to extend and flex. Oh, I lost one. Whenever you kind of feel it, or they feel it to start coming off, they can just give it a little pump. And you can go get a cup of coffee. Alright, so I'm just going to go back and forth for a minute. So after 1 minute, what I'm going to do is I'm going to go into slight adduction, right, so that I can really focus on that lateral, that vastus lateralis. Yeah. When I do bend it, I do find that I have to really pump this because I can feel that cup moving. Lost my adduction there for a minute. I kind of just didn't focus on it. So you want to watch your patient, make sure they don't just go into that relaxed position. You want to think of them adducting. It was also a pretty good grip workout. So that's 2 minutes. Next, you're going to have your patient sit upright. Okay, we're going to go ahead and release this cup. Thank you. And then we're going to release this cup. Just take some of that pressure out. Good. And then we're going to leave this lateral retinaculum cup there, and we're going to start some gliding techniques for about a minute. So I'm just going to let some of this air out, and then I'm going to keep it in. And what I want to do is I'm going to flex my knee and glide up, and then I want to extend my knee and glide down. So glide up, flex, extend, glide down. We'll do this for about a minute. So after you've done that for about a minute, you just want to do some soft tissue, some gentle soft tissue to move those fluids around, move that ground substance around. And then lastly, it's time for us to retest to see where we're at, to see if our intervention was successful. All right, are you ready? Okay, here we go. Right at 70. Right at 70. Where did I start? 50? 54. 54, so that's 16 degrees. That is significant. Now your squats. All right, so next let's retest those squats. Side view, left side. Better. I stopped right when I started feeling a little bit of pain, but in general, better. Right side again. I could probably do a full pistol on that side, but not this side. And that concludes my in-service. Thank you very much.